Hello, my name is Dr. Stephen Carney, Emergency Department Chair and Medical Director for the Stroke Program at Parkview Community Hospital in Riverside. Of course, our team is here around the clock to help treat patients with COVID-19. But today, I'd like to talk to you about other types of emergencies. Because of a fear of contracting COVID-19, emergency departments across the nation are seeing a downturn in caring for patients who show symptoms of stroke or heart attack. Now, we know that strokes and heart attacks have not ceased. What this decrease in ER visits means is that people are staying home instead of seeking emergency treatment. The very real danger is that without urgent and immediate medical attention, many people will face long-term health consequences or even death in these circumstances. So first, I'd like to share with you some symptoms of stroke and heart attack to be aware of. And then we'll talk about what Parkview is doing to help keep you safe during the pandemic. Let's review some important information about strokes. A stroke is a neurological emergency, and there are time-sensitive treatments that can help minimize long-term effects in many cases. We use the phrase time equals brain because time lost is brain lost. During a stroke, every second counts. You may have heard the acronym BFAST, B-E-F-A-S-T, which can help you recognize common signs of stroke. Let's say you're caring for someone who might be at risk. Here are 5 things to be on the lookout for. Again, the acronym is BFAST. B is for balance. This might look like dizziness or a loss of coordination or balance. E is for eyes. There may be a sudden loss of vision in one or both eyes. F is for face. You might notice facial weakness or a lopsided smile. A is for arm weakness. When you ask the person to lift their arms, are they unable to do so on one side? S is for speech. This could include slurred speech or difficulty repeating simple phrases. And T is for time. If you notice any one of these symptoms, it's time to call 911. When you seek medical attention early, the time you save could save your life or the life of someone you love. Parkview is a primary stroke receiving center, and our hospital meets strict standards associated with best practices and successful outcomes. So remember, if you spot signs of a stroke, be fast. Heart attacks are the leading cause of death in the United States. Here in the US, someone has a heart attack every 40 seconds. A heart attack happens when a part of the heart muscle doesn't get enough blood or oxygen. The more time that passes without treatment to restore blood flow, the greater the damage to the heart muscle. Patients who are at a higher risk for heart attack include older patients, those with kidney disease, diabetes, high blood pressure, high cholesterol, smokers, and those with existing heart disease. Here are 5 major symptoms to be aware of. The first is chest pain or discomfort. This could feel like uncomfortable pressure, squeezing, fullness, or tightness. The second is feeling weak, lightheaded, or faint. You may also break out in a cold sweat. The third is pain or discomfort in the jaw, neck, or back. Pain or discomfort in one or both arms or shoulders is a 4th symptom. And the 5th symptom is shortness of breath. If you or someone you love might be having a heart attack, we recommend you call 911 immediately so you can get to the emergency department and let us treat you. When you arrive at our brand new state-of-the-art emergency department, you can be sure that Parkview has exceptional safety measures in place for your peace of mind. Our team adheres to strict infection protocols, and we take precautions to separate patients who might be COVID-19 positive or at risk. Masks are provided for everyone, and our staff always wears appropriate protective equipment. Our emergency department allows for care of non-COVID patients in private, fully enclosed rooms. COVID patients are cared for in a separate, dedicated unit, which is isolated from other parts of the hospital. I hope this information helps you feel comfortable in coming to Parkview should you or a loved one need emergency care. In the case of a stroke or a heart attack, it may mean the difference between life and death. At Parkview, we stand ready to care for you when you need us most. Thank you for your time.